We actually really want you to continue to work out during pregnancy. There's lots of great data that show that women who are active during their pregnancies have healthier pregnancies and also easier deliveries. We do want you to avoid sports that have high risk of falling. So, things like skiing, snowboarding here in Colorado, those are common ones we get asked about. We tell women if you were doing something prior to pregnancy, it's absolutely fine to continue to do it as long as you feel good. If you're feeling dizzy, lightheaded, feel like you're overheating, those are things we would want you to kind of step back from. There are also weight restrictions. Later on in pregnancy, we want you to decrease your lifting limits, so less than 20 pounds once you hit roughly the midway point through the pregnancy. There are a few things we want you strictly to avoid during pregnancy, one of them being alcohol, another one being sprouts. So uncooked sprouts can be a carrier of bacteria that can harm the baby. Soft, unpasteurized cheeses, another one common carrier of bacteria. Some of the things that we want you to enjoy in moderation would be fish. There's some good data that high consumption of fish, particularly that type that is high in mercury, can have developmental repercussions for the developing baby. And so something we want you to generally consume fish 2 times a week and no more than that. We get questions a lot about sushi, and sushi is actually okay to eat as long as you are eating it from a reputable place where you trust their hygiene and cleanliness practices. Some of the things actually that there's a good reason to be eating more of would be things that are high in monounsaturated fat, so the healthy type of fat. Those include things like olive oil, nut butters, avocado, those type of things, and those are healthy for the developing baby. We also want you to eat really a broad, well-balanced diet, so lots of fruits and vegetables. Try to minimize simple processed carbohydrates, eating complex carbs where you feel like you can, and lean protein sources also very important. A lot of women don't get enough protein in their diet when they're pregnant. The labor and delivery process is one that can't entirely be predicted or controlled. Every labor is a little bit different, and there may need to be changes in that birth plan. If the doctor's recommending a change, it's for a specific reason. Get all of the information relative to why that change is being recommended, and then know that you still have a voice. You still have a say in this process. No one is wanting to kind of take over that control. Having something really concrete with lots of must-haves on a checklist is really just setting yourself up to be disappointed, because while we can achieve many of those things, I never like patients to look at that birth plan as like if we don't check all these boxes, we have somehow failed. Because if you have got a healthy mom and a healthy baby at the end, you have succeeded.